Thank you very much, Sarah. I am Elvis Temfack, Senior Research Officer at Africa CDC. Good morning, everyone. Good afternoon or good evening, based on where you are joining us from. So I'm equally delighted as I was yesterday to welcome you to this day two session of this workshop. Day one was quite interesting with so many um, good experience that was shared and some really constructive discussions. And so we look forward to the same discussions on day two. And we would like to thank everybody who could avail themselves to be part of the panel as well as the participants. And we highly encourage the participants to um, uh, be part of all the sessions. Some may be long, but I mean, it's because of the interest of the topic that we have to make it a little bit long like this, and we will not be able to exhaustively discuss all what social science in uh, research in outbreaks is all about, but we're going to try our best to make sure that these discussions are constructive enough for us to learn from the experience of all the panelists who are here. So I also like to thank our partners who are here, and I wouldn't be long. And I would say let's have a very nice session this afternoon, and um, have a nice day. Thank you.
So the agenda for today will be developing some of the themes that we discussed yesterday. Now, yesterday, you'll remember that we had a huge discussion about the range of different social science disciplines within the sort of faculty, if you like, of social sciences. And we were also hearing that at least initially, there seemed to be a real emphasis on just anthropology, whereas we were saying that there's so much fabulous and interesting work being done in other disciplines. And so part of this work, and indeed a wider project that I'll go on to explain in more detail shortly, is to try and identify gaps in current provision and to see what opportunities there might be for integrating different social sciences according to the needs of different outbreaks, so that the responses can be best managed in order to be best informed for an effective and efficient response. So to give you some more detail about the role and the needs of policy in this area, this workshop is forming part of, as I mentioned yesterday, a wider effort to identify what some of the gaps are in current provision and what opportunities there might be from other social science disciplines to respond really to what actual needs first responders are being faced with in the field. So this is to get a much better idea how research in social sciences is fitting the bill, meeting the needs, the actual needs as experienced in the field, and how these can be integrated in ways that don't impede the response team's work to respond to an outbreak, but clearly facilitates it, makes it more effective, and indeed more efficient. We know that outbreak management is very often as much a social activity as it is a medical or technological one. And for that reason, the emphasis on the role of social sciences has been increasingly recognised as being very important indeed. So the wider efforts here, and I'm very pleased to tell you we've got the help of of 4 policy students at UCL who are very kindly putting together some activities that will help inform policy making, and particularly will assist the African CDC in thinking through what some of the opportunities are in integrating different social sciences, what they can offer, how they can best meet the needs of you in the field. So in order to proceed with this, we've got, you know, the training workshop that you're all currently attending for capacity building, and that's for you, for policy making, and to engage in a far more consultative, wider effort. What we're doing is hoping to complete an online anonymous survey. The link was shared yesterday and it'll be shared again today, but later on today, just before the interactive session. This is entirely voluntary. All the anonymous results will be stored at UCL and shared with the African CDC once analysed. So again, very thankful to my MPA team, Masters in Public Administration, that they're able to help us with this remarkable effort. We've also got an expression of interest form. Again, the link will be posted again later on today, so that if you're interested in taking part in any interviews and focus groups with the team based at UCL, but with the intention of informing policy and sharing the data with the African CDC for their benefit, then please do complete the expression of interest form accordingly. And we will be sending you by email full information sheets and consent forms should you wish to take part any further. If you don't, all data will simply be deleted, as will the raw data from the anonymous survey that will be, you know, completed by some of you should you wish. There are then the Mentimeter activities. Again, these are, you know, entirely voluntary, but it's intended as much as an educational element. So this is where we can participate and gain results, consultative results in real time, so that we can discuss and share with you what issues you're encountering, what disciplines you're more familiar with, how you might go about navigating some of the tricky issues that might crop up between disciplines, and indeed how you would think about integrating social sciences within the work that you do. I mean, it's increasingly important that that the research that's planned really does have an intimate connection with the field work. So what problems you're facing on the ground. All too often we have research that's been designed and planned from completely outside the immediate environment and context, and so maybe not meets the needs or is designed in a way that's appropriate for the participants being recruited. So it's with that in mind that we're trying to engage with a much more interactive and consultative effort to support the African CDC in their awareness of what the options are for social science and how we might go about modelling this integration process. And today we're going to be hearing much more about how we integrate different disciplines. So we're going to be looking at cases of where people have worked together, so not only from different social science disciplines, but with the clinical and epidemiological researchers, and first responders. So I'm very, very pleased that we've got some of those worked examples, as well as worked cases, worked examples of mixed methods research. So this is following on from what we introduced yesterday. So we looked at anything from geography and ecological methods through to anthropological and qualitative research, and the psychological and quantitative research that could be possible. In addition to looking at theories and how we might regard the role of social science theory, and how we might navigate and try and have an all-encompassing model that would enable and facilitate collaboration rather than impede and hinder it.